WDHA has had a long and wonderful relationship with the Community Food Bank of New Jersey, and their Students Change Hunger program is about to start. But there's also something else very special that starts on Monday of this week that I want to talk to you about this morning. And I have Xenia Ferencevych. Did I pronounce that correctly?
Very good, Jim.
Xenia is the corporate volunteer manager for the Community Food Bank of New Jersey. And this is a little off the beaten path. When you think of Community Food Bank, you think food, but you're doing a diaper drive that starts tomorrow. Tell our listeners about that.
Yeah, it's a very exciting inaugural event, but I will say that Diaper Need is part of the need we see in the food insecurity space. So it's totally aligned with what we normally do as a food bank and as advocates for food security in New Jersey. And what we're doing this week is really just highlighting the work we've been doing and hoping to engage the community in taking action with us. This week is National Diaper Need Awareness Week. That is a designation by the National Diaper Bank Network, of which Community Food Bank of New Jersey is a member. And we are really leveraging this week to inform our neighbors, our community stakeholders, and anybody who is interested in this issue to do something. And the something that we propose is all under this umbrella that we're calling Great Big Diaper Drive. Hashtag Great Big Diaper Drive. And it's an initiative that's being led by our Women Fighting Hunger Volunteer Corps here at the Food Bank, along with some members of our Emerging Leaders Board and our colleagues and board members in our Egg Harbor Township location. And to give a bit of context, some of our ELB board members last year in August, along with the New Jersey Pandemic Relief Fund, did a social media awareness campaign around diaper need. And what Great Big Diaper Drive endeavors to do, leveraging this week, is to sort of expand on that effort. And as I said, engage our community stakeholders in a variety of ways. That includes hosting a diaper drive, raising funds for diaper need, or doing a social media awareness raising campaign. And what Women Fighting Hunger and our ELB members have done is create a toolkit and ways in which to very easily come on board and help us do that.
And one of the stats that I saw, and I should, I guess, be aware of this. I have 3 kids. All of them obviously went through diapers. A baby can use up to 12 diapers a day. And so if you have, like we have our 2 younger ones, we're in diapers for a little while together. That adds up more than you can imagine. My sister-in-law, Xenia, has triplet boys. So, and they're long out of diapers right now. But I think back to those days, and that's overwhelming. So for a family that has one, that's 12 a day is enough, but then you start, if there's more kids involved, and it gets even more critical.
Absolutely, and it's over a number of years. And if you are an individual that struggles to purchase groceries or find food, you don't have the resources to buy diapers, which are very expensive. They can be $70 to $80 a month of an expense. So that is why we, as the Community Food Bank of New Jersey, address this as part of our programming in general, and why we're very excited about this week, because it is a need that's not supported by and large by federal assistance programs. SNAP does not cover the purchase of diapers, nor does WIC. So again, turning to our neighbors who are challenged to find food or are food insecure, they're not finding other assistance to purchase these diapers, which are an expense, which you do use a lot of with babies and toddlers, and sometimes it goes a little longer. Mm-hmm. So yes, it's tremendous. And in New Jersey, we have it's a pre-pandemic statistic, but about 69% of the mothers in the workforce have little children at home. That's above the national average. Again, pre-pandemic. This is according to the National Diaper Bank Network. So we are above average in terms of the need by moms or other caregivers. And I'll also add that if you don't have a supply of diapers and you're a working person, you can't leave your child at an early child care center. Daycare doesn't accept children without a supply of diapers. So what do? How do you go and earn that paycheck if you can't leave your children in the care of somebody and not have that resource? So, and let's not forget the health effects. Children who sit in a diaper all day long, do not have the 12 to rotate through, will be in a soiled diaper. It has a lot of health implications. So it's a public health issue, it is an economic issue, and it is a food security issue. And again, this week we are raising the awareness and hoping to engage the community in amplifying that, but it is a need that is year-round as well.
Xenia Ferencevych, my guest this morning here on the Jersey Magazine at 105.5 WDHA. You mentioned pre-pandemic. What has the pandemic done to this situation? Do you have numbers on that?
Not quite yet, but that's an excellent question. We do know that in our work for COVID-19 recovery and relief, that those who were challenged before the pandemic have fallen deeper into food insecurity. They're lowly food insecure. And then there are new folks that are unemployed, that are not able to make ends meet. So we know that the need has increased. And there are moms and caregivers in that cohort that are struggling to find the diapers. They need clean diapers to give their children. We are always on the lookout for metrics. That's what we like here at the Food Bank. And one of the events that we're going to be hosting, the Women Fighting Hunger and ELB, this coming week on Tuesday, is a virtual lunch and learn, which one can register to attend through our website, which I'm happy to give that address in a moment, to learn more about those statistics you ask about, Jim. We're going to have our founder and longtime board member of the National Diaper Bank Network, Kathleen DiChiara, as a speaker, as well as our network leader, Jennifer Nelson, who manages these programs of ours, Diaper Need, as well as menstrual equity here at the Food Bank, and one of our network partners who administers this program at a local pantry. So there's going to be a lot of information about that, and so we hope that the audience is able to join us.
You know, one of the things, Xenia, that we talk about every year when we work with the Community Food Bank of New Jersey, I think we don't always understand the amount of people who are food insecure, because this area that DHA broadcasts to contains some of the most affluent counties, not just in the state, in the country. So, you know, you look at that, and I think sometimes we overlook the fact that there is a large segment of the audience and this area in general that is food insecure. And I think that's a stigma that we really have to overcome. We really need to be more aware of this. I think it goes without saying.
Yeah. And, you know, a simple example may be if you're in one of these affluent communities and you have children, school-age children, as an example, and if you ask them, you know, or look into your public school system, you know, what percentage of children receive federally funded meals during the day? That there tells you that there's eligibility in your community, that there are people who require that assistance. And it is true, it is everywhere, it is in your neighborhood. And because unfortunately there's still stigma associated with it, people don't talk publicly about it. So it's incumbent upon us working in this space and our allies who are out there listening today to amplify that information and have folks understand that there is that need. It's very real and it's not going away anytime soon. You know, the pandemic really set us back. We have seen that there was a lot of support to help those neighbors in need during the pandemic, which I think mitigated perhaps a worse scenario that could have been, but that doesn't negate the fact that folks are still not able to get enough nutritious food during the day, during the week, to have active, healthy lifestyles, which is the definition of food insecurity.
National Diaper Need Awareness Week, Monday, September 27th through October 3rd. Xenia, if WDHA listeners want to get involved, what do they do?
Please go to our landing page. It's on our website. The address is CFBNJ.org/GBDD. That's the acronym for Great Big Diaper Drive. And that is the campaign that's being amplified this week. And you can find all the information about the presentation I mentioned, the lunch and learn, and ways to become engaged. So we do hope you visit us, and we hope to see all of you on Tuesday.
Once again, the web address is CFBNJ.org/GBDD. Xenia Ferencevych, thank you so much for your time this morning, and best of luck with this event this year.
Thank you so much, Jim. It's been a pleasure.